So I'd like to talk about a question that epidemiologists like me and our teams have been asked a lot over the last 20 months and what it can tell us for wider science. And that question's along these kinds of lines. So it's something that we've received from governments, from health agencies, from a whole range of different organizations. And the reason that those questions come to a group like ours is in many ways the way that our field has ended up being structured. And that's one where you've had a relatively small number of institutions that have the capacity, the domain knowledge, the skills to implement really real-time, rapid analysis. And that's whether that's kind of developing epidemiological insights or developing scenarios and being able to turn that around. You have this relatively small number of institutions globally, and then that means that governments and organizations will often come to them with requests for support. You'll get some discussion of what support is required, what that entails. Often you'll have some element of data sharing that goes across. Then those centralized institutions will develop refined methods and tools, share their analysis, and that might inform policies or other activities. And then you'll get that eventually becoming public through some kind of journal paper and sometimes code published alongside that paper. There's a lot of issues with this model, and a lot of these steps really reduce the efficiency and sustainability of what we're doing here. First of all, requests for support. If you have a small number of institutions, you very quickly become overwhelmed with requests. You can't support absolutely everyone out there who needs it. You also have a problem with discussion of needs. You need to make sure that what you're doing accounts for local context, and obviously building up that kind of knowledge and that kind of discussion in real time is going to slow down what you're doing and affect your ability to respond. Similarly with data sharing, there's going to be legal issues, there's going to be ethical issues around health data. And again, if you're in the middle of an epidemic, those kind of processes can slow down what you want to do. There's also problems with how that's translated and communicated. If you've got centralized institutions, historically, we've seen a lot of examples where the papers that come out really don't reflect where the response is happening and the groups that are really kind of on the ground being affected. And then likewise, in terms of code that comes out of these kinds of activities, in many examples, code hasn't been published, or if it has been published, it's not documented, it's not maintained, it's not sustainable. One example, so we last year did some work on underreporting, that the code we developed was getting reused by media agencies, by various governments. Nice analysis implemented in TensorFlow, but because it was linked with a specific study, we didn't have the capacity to maintain it and really engage with the community as we would have liked. So how can we move beyond this kind of model for doing epidemic analytics? Well, what we've been thinking about and what we really want to see is something that's more decentralized. So you still have these existing institutions with expertise, but rather than discrete papers and ad hoc code, you have something that's much more a focus on maintaining these libraries, packages, and then building on that with links with local hubs. So these might be other institutions, these might be teams within ministries of health, but you're really focusing on that development and maintenance of software, and then training and ensuring that you can have collaborative development around what the issues are that are of interest and relevance to them. And then in turn, those local hubs can do all the activities I've already talked about, but things like data sharing, local context, a lot of those may well already be established. So that really kind of speed up those kind of processes. And if you do get outputs, that will be reflecting where this work is happening. And of course, those centralized institutions can still take on projects, can still do the work they're doing. And if anything, will have more confidence in the code and analysis they're using, because they have much better maintenance of these tools rather than ad hoc previous work. And then it allows scalability, because you've got this community management, you can build up other hubs. These hubs, you can benefit from network effects. They can be developing and publishing their own resources as a result. So that's really what we want to see and what we want to move towards. And that's something that we're doing. This is launching in the next couple of weeks, but I thought I'd give you a sneak preview. It's a partnership between a team we've got in London and one in the Gambia, really aiming to move away from this ad hoc single project approach to one that's scalable and sustainable, having engineering, having community management, and we hope creating a framework so we can expand this to other regions and really avoid a lot of those bottlenecks that I described earlier on. So thank you.